Good morning, my lovely people. Let me start by welcoming you back to my YouTube channel once again. And as always, I always start by appreciating you guys for the far you have taken me. You have really put a smile on my face because before I started this channel, I never knew whether it will help so many people in the community. I never knew whether so many will appreciate my job. And through God, this channel has touched so many lives and it's helping the community at large. I always thank each and every one of you in whatever little you are doing to push this channel ahead, be it by subscribing, liking, sharing, and also commenting on my videos. And also those who are bringing out their topics for them to be discussed. You are part of this channel, you are part and parcel of this family, and feel appreciated. For the better part of the past few months, we have been talking about generally the breast, which is one of the organs in our female reproductive organs, which is very important. And today we will be discussing about how to diagnose breast swelling causes. Diagnosis of breast swelling causes. And before we continue, if you are there looking at me and you have not subscribed, consider subscribing, liking, and sharing so that you may promote or you may push this channel ahead. Diagnosis of breast swelling causes. How do you diagnose the breast swelling causes? To diagnose cause of breast swelling, your doctor or your healthcare practitioner will ask you questions about your symptoms. To diagnose the cause of breast swelling, your doctor or your healthcare provider will ask you questions about your symptoms. For example, they may ask when your symptoms began, when the symptoms began, and whether they get better or worse at certain times. This is very important, that to diagnose cause of swelling, your doctor will ask you questions about your symptoms. For example, they may ask when your symptoms began and whether they get better or worse at certain times. The doctor will also examine your breasts. This is what we call physical examination, be it by palpation or whichever way. They will also examine your breast tissue and see or feel for the lumps. Because you have to palpate the breast, and if it has a swelling, you feel for the lumps. Sorry. So they will also examine your breast tissue and feel for the lumps. They may recommend imaging tests such as mammogram or breast ultrasound to view the internal structures of your breast. The further doctor can go through the examining is feeling whether we have a lump inside or not. To ascertain or to get deeper details about the lump which is inside your breast tissue, your doctor can only do this by recommending imaging tests such as mammogram of breasts, ultrasound to view the internal structures of your breasts. I hope you get that point correctly. So, the doctor has examined. The doctor has sent you for mammogram or ultrasound. The doctor has made a diagnosis. What is the next point? What happens next? So, obviously, After making a diagnosis, the next step is what we call treatment. So, treatment of a breast swelling. How will your doctor manage or treat your breast swelling? How? Your doctor recommends treatment, or your doctor's recommended treatment plan will depend on the cause of your breast swelling. What are we saying here? That the treatment modality to be used majorly depends on the cause of the breast swelling. So, you have to know the cause as a doctor for you to be in a position to give your client or your patient a treatment plan. If the swelling is caused by an infection, get this right. If the swelling is caused by an infection, they may prescribe antibiotics. If the swelling is due to an infection, which is always a bacterial infection, the doctor may prescribe antibiotics. The antibiotics will kill the bacteria, then the swelling will subside or the swelling will go away. You can also learn how to keep your breast tissue clean and dry to prevent further infection. You can also learn how to keep your breast tissue clean and dry to prevent further infection, or what we call reinfection. Reinfection is whereby you have an infection, get healed, then it recurs again. That's what we call a reinfection. So you can also learn how to keep your breast tissue clean and dry to prevent infection. If the swelling is caused by an hormonal change, or if the swelling is caused by hormonal changes related to your menstrual cycle, your doctor may prescribe birth control pills which can relieve breast swelling and other symptoms of PMS or premenstrual syndrome in some women. Let me repeat this again. If the swelling is caused by an hormonal related, or if the swelling is caused by hormonal related changes, if the swelling is caused by hormonal changes related to menstrual cycle, your doctor may prescribe birth control pills which can relieve breast swelling and other symptoms of PMS or premenstrual syndrome in some women. Let me repeat again. If the swelling is caused by hormonal changes related to menstrual cycle, your doctor may prescribe birth control pills which can relieve breast swelling and other symptoms of premenstrual syndrome in some women. Not all women, but some women. If you are already using hormonal contraceptives, or if you are already on an hormonal contraceptive, they may encourage you to switch to another type, or you change the type of contraception. If you are already using hormonal contraceptive, they may encourage you to switch to another type. Why? Maybe the one you are using is causing the imbalance in your body and hence the symptoms you are showing, or it may be leading to hormonal changes which can lead to breast lumps. So they can advise you to change the method to see what happens. So if you are already using hormonal contraceptives, they may encourage you to switch to another type. If you are diagnosed, if you diagnosed with breast cancer, your doctor's recommended treatment plan will depend on the type, location, and stage of your cancer. Definitely, after diagnosing cancer, you have to stage it because each stage has its own treatment plan. So, if you are diagnosed with breast cancer, your doctors recommend treatment plan or your doctor's recommended treatment plan will depend on the type, location, and stage of your cancer. Doctors may prescribe chemotherapy, radiotherapy, surgery, or combination. Doctors may prescribe chemotherapy, radiotherapy, surgery, or combination. Tips to relieve discomfort associated with breast swelling. What are the tips, or what can you do to relieve symptoms associated with breast swelling? Number one, wear supportive bras. Wear supportive bras or make sure your bra fits properly. These are tips to relieve discomfort associated with breast swelling. Wear supportive bra or wear supportive bra or make sure your bra fits properly. Number two, apply a cloth covered heat pack or ice pack to your breast for up to 10 minutes at a time. Apply a cloth covered heat pack or ice pack to your breast for up to 10 minutes at a time. Use over-the-counter pain relievers, for example, ibuprofen or brufen. This marks the end of our first video today. Guys, thank you for being with me. Thank you for supporting this channel. Let's continue subscribing, liking, and sharing our videos so that they may be recommended in the whole world, and our channel will grow bigger and bigger. Each and every one of you who is pushing this channel ahead, be blessed. And if you are there and watching me and you have not subscribed, subscribe, like, comment, and share. Let's meet in our next video tomorrow.